First thing I'm going to do in the patient's room is wash my hands and ensure patient privacy. Next, we're going to gather our equipment and supplies needed. Then we're going to verify the physician orders, introduce ourselves to the patient and their family, and then we're going to identify the patient using 2 patient identifiers. While I check the wristband, we're going to ask them their name and date of birth. And then we're also going to assess the patient's pain level and explain the procedure, and while they agree to the treatment. If there is a risk of spray, then we would use goggles, gowns, and mask. And now we're going to position the patient and instruct them to not touch the wound area or the sterile field area once we get started. Then we're going to place our disposable biohazard bag in a convenient location while making a cuff at the topmost part of the bag. Place that right there. Next, we are going to apply a pair of clean gloves. Now we're going to remove the old wound dressing. We're going to pull the tape parallel to the skin in the direction of the dressing while holding down the non-wounded skin and moving in the direction of the hair growth. Be careful to remove layer by layer so we can inspect for any drainage. And we want to place this away from the patient so they do not observe the drainage of the dressing. Once observed, then we're going to dispose in our bag. The next layer, observe for drainage, dispose in our bag. Next, we're going to remove our gloves. Perform hand hygiene and apply a new pair of clean gloves. Now we're going to inspect the skin for its color and integrity. We're going to look for edema, exudate, and loss of skin. And we're going to palpate the area around the wound, being careful not to touch the wound because it is sterile, for any pain, and assess for drainage. If indicated, then we would measure the length, width, and depth of the wound. Now we're going to dispose of our gloves and wash our hands. Now we're going to create our sterile field. To create the sterile field, we will remove the top part, grab our sterile field dressing, now we're going to apply our sterile gloves. At all times, keeping our hands above waist level. We're going to apply our dominant hand first. Non-dominant hand next. Now we're going to remove our sterile supplies, including our non-sterile normal saline solution, our gauze pads that we're going to use to clean the wound and dry the wound, and then our new gauze pads to apply the dry dressing. Now, to clean the wound, we need to take our gauze pad, Dip it in the normal saline solution and clean from least contaminant to most contaminant area and dispose in our bag. Again, take our gauze pad, dip it in the normal saline solution, clean from least contaminant to most contaminant, dispose. Now we'll take the dry gauze pad and blot the area dry. Dispose. Dispose. And now we are going to, if ordered, apply an antiseptic ointment. Yet today it is not ordered, so we will not apply that ointment. Now we are going to apply our dry dressing. So first is going to be the loose woven gauze pad as the first layer. If the wound was draining, then we would add a 4x4 gauze and then add additional layers if needed. Then we're going to add a thick layer onto our wound, a thick layer of gauze, that is, to our wound, and then we're going to tape our wound. So we have our tape. Now, per organization's policy, we're going to label the tape with our initials, the date, and the time. Now we're going to remove our gloves. Wash our hands and apply our final clean pair of gloves. Now we're going to dispose of all of our used supplies, including our normal saline solution, all of our paper, into the wound container, into our disposable bag. Now we're going to make sure our patient is in the comfortable position. Call light is next to their bed. Bed lowered to the lowest position. Side rails up ×2. Remove our gloves. Wash our hands for the final time. And document and report the patient's response and outcome.